All right. Welcome everybody tonight to the 2nd District PTA 411 meeting. My name is Michelle Parker. I'm the Vice President of Legislation for the District PTA, which means that I support all of you in your advocacy efforts and coordinate our district-wide efforts to advocate for students. We are excited tonight to welcome Anna Validzic from the San Francisco Department of Public Health to hear about the most recent data and guidelines from the department. Welcome, Anna. But before we continue, I want to give our interpreters an opportunity to make announcements about how people needing Chinese and Spanish interpretation can listen and participate. And I also want to let you know we're recording this meeting. It'll be posted by Friday to the 2nd District PTA YouTube channel. We're also streaming it live to the 2nd District PTA Facebook page right now. All right, Andreina. Andreina, you want to unmute yourself first?
Thank you. Bienvenidos a la reunión del segundo distrito de la PTA 411 de esta noche. Es Michelle Parker y es la presidenta de la legislación de PTA del distrito, lo que significa que los apoya a todos en sus esfuerzos de defensa y coordina los esfuerzos de todo el distrito para defender a los estudiantes. Nos complace dar la bienvenida a Anna Validzic del Departamento de Salud Pública de San Francisco para conocer los datos y las pautas más recientes del departamento. Los participantes que desean escuchar la reunión interpretada en español deben llamar al 602-580-9502 e ingresar el código de acceso 3927210 #. Puede ver la reunión a través de Zoom y escuchar a través del teléfono. Cuando llegue el momento de las preguntas y respuestas, si tiene alguna pregunta, escriba su pregunta en español en el cuadro de chat de Zoom. Y cuando el moderador la vea, me pedirá que traduzca la pregunta para que pueda ser respondida. Nuevamente, el número para llamar es 602-580-9502 e ingrese el código de acceso 3927210 # o numeral. Gracias, thank you.
歡迎參加今晚所舉行嘅第2區家長教師協會 PTA 411社區會議。Michelle Parker 佢嘅中文名叫做柏美斯，係第2區 PTA 立法副主席。佢致力於教育倡導工作，同時積極協助同埋協調改善校區事務，並為我哋嘅學校咧嘅學生提供適當嘅資源同埋引導。今晚我哋非常榮幸可以邀請到三藩市公共衛生局 Anna Validzic 參加本次會議，並聽取公共衛生局最新公佈嘅數據以及衛生指引。本次會議咧，我哋會全程錄音，並且同時我哋會喺第2區嘅 PTA 臉書頁面進行直播。星期5之前，我哋會公佈喺第2區 PTA YouTube 嗰個頻道。咁參加會議嘅人士咧，同埋各位聽眾咧，請注意啦。如果想要聽呢一場會議嘅粵語翻譯嘅話咧，記得撥打720-740-9703之後再按接入嘅密碼740-8742井號鍵。咁樣咧，你就可以邊睇 Zoom 嘅視頻會議，邊聽電話翻譯。當開始問答環節嗰陣咧，如果你有問題要問嘅話咧，你可以喺 Zoom 嘅留言板，即係我哋講嘅 chat box 嗰度咧，就打中文留低你想問嘅問題。會議主持睇到你嘅問題之後咧，就會叫我哋嘅中文口譯員咧翻譯成英文嘅。再重複一次，中文翻譯頻道嘅電話號碼係720-740-9703，之後再按接入密碼740-8742井號鍵。Thank you.
Thank you very much to both of you. Before we get started with the town hall, I want to let you know again, if you're just joining us, that you are welcome to add the name of your school to your image in Zoom by hovering over your image and clicking on the 3 dots that appear in the top right corner. If you click on rename, you can add your school name to the right of your own name so that we can all see who is represented tonight in our meeting. And I want to also let you know about some upcoming PTA 411 meetings. which all of you and anyone in your school communities are welcome to attend. Next week, on Wednesday night at 7:30, the PTA will consider endorsing 3 ballot measures on the San Francisco November ballot. Prop G, which is about youth voting, Prop F, which is the business tax overhaul that would put funds towards early education and housing and homelessness, and Prop J, the SFUSD parcel tax. We will hear both from the campaigns and the PTA study committees presenting reports and we'll have a member vote. The following Wednesday, on September 9th, from 7:30 to 9 p.m., we will have a coach who's coming to speak with parents about how to manage parent stress during this time when people are trying so hard to balance work and caring for children. So I hope you'll be able to join us for both of those the next 2 weeks. And now we are going to move on to the main part of our meeting. Ms. Validzic will make a presentation to us, and then we will spend the remainder of the hour answering your questions. Many of you pre-submitted them at registration, and so we will go through those first. And if you have any others during the meeting, please go ahead and put them in the chat box, and we'll get to as many of them as we can within the hour. So now, Ms. Validzic, thank you so much for making time to be with us tonight. Would you mind first just introducing yourself for a minute, and then you can go ahead and share your presentation. And when you're finished, I'll remind people how to go about doing question and answer at that point.
Absolutely. Thank you for having me. My name is Anna Validzic. I work at the San Francisco Department of Public Health. I have been at the Department of Public Health for over 18 years. In various capacities, but since March, I have been activated with a team and I am the team lead for all issues related to childcare, schools, and higher ed. And I'm working with a fabulous team of 7 public health nurses, responding to all inquiries and calls, and helping to do contact tracing and case investigation and cases related to these sites. So I'm very happy to be here and present and answer any questions that you may have. So I'm here to talk obviously about COVID-19 and the impacts of this virus on schools and distance learning for this upcoming school year. So next slide, please. Normally, I give this presentation with our health officer, and I am a poor substitute, but I will do the best that I can. But what we do is we are looking into what factors go into deciding about whether it is safe to continue reopening. And this is for San Francisco at large. And there are 5 main indicators that we are tracking in order to decide how we can reopen different sectors of San Francisco. And it's mainly to navigate our capacity. So the impacts on our hospital system, and if we have enough hospital beds in case there are hospitalizations related to COVID, the case rate, and whether it is rising, declining, or stable, testing, and our testing capacity, our capacity to do contact tracing so we can isolate the spread of this virus, and of course the amount of personal protective equipment. And the other factor that helps us determine whether to reopen is obviously if we're on the state county's monitoring list, or otherwise known as the watch list, or whether we are off of it. So next slide, please. So this is data that is readily accessible on our website and was accessed a few weeks ago. But as you can see, we did a really good job in the spring of flattening the curve, both for hospitalizations and for cases. And then we started to reopen sectors of San Francisco, and we saw a sharp rise in both cases and hospitalizations occurring in approximately late June. And this is data that we have on our website that we can share in the chat of the link if you don't have it, where you can track it on a regular basis. And this is how we monitor how well we are doing in preventing and mitigating the spread of this virus. Next, please. We are obviously seeing inequities in the, some health inequities in the spread of this virus. And you can see here from this map, which is also publicly accessible data, that there are certain neighborhoods that are more heavily impacted by COVID-19 than others. And it primarily is on the eastern side of the city. And then also in heavily concentrated in the southeast sector of the city and certain neighborhoods. So we are focusing our support services where the data tells us is the we need to focus our energy and efforts. Next slide, please. So in order to move forward for reopening San Francisco, we obviously saw the surge, which put us on the county monitoring list or the watch list, which forced us to pause reopening. And in order to continue to reopening, we all have to do this together. This is a shared responsibility, and in order to reduce the community mitigation, there are 4 main strategies that we can do to mitigate this virus. So one is to reduce our mobility and mixing of households in order to prevent the spread. We also want to, I'm sorry, but the power just seemed to go out in my house. Okay, that's new. I will continue. There is a, we want to have adequate ventilation and see if you can get as much fresh air as possible, including getting outside as much as possible and opening the windows. Also, limiting the amount of close contact. So the amount of frequency, that's why we recommend staying 6 feet apart and are asking, limiting the amount of people that are gathering outside. And also face coverings, hand washing, and healthy hygiene. Sorry about the lighting situation. Face coverings is proving to be incredibly important in limiting the spread of the virus, as well as healthy hygiene and hand washing and making sure the areas are clean. And you can see here this image of how masks really reduce airborne transmission. So some of the strategies that we use in the city to work on fighting this pandemic is obviously our health order, including our stay-at-home health order and our face coverings health order. But then we also write guidance on how to address certain areas, such as childcare or schools. And that guidance then gets turned into a health directive, which gives it legal a legal weight and legal it makes it legally binding. Other strategies that we use is, of course, testing, contact tracing, and support people that are in isolation, and especially in data-driven hotspots. We want to promote community health education campaigns, as well as some enforcement, and of course, monitoring this disease and trying to find it as soon as possible and doing some investigation. Next slide, please. So what does this mean for safer reopenings for schools? To do that, in order for schools to have a safer reopening, we must meet minimum health and safety standards. And this is regardless if San Francisco is on the state watch list or not. Research has shown that we really have to have lower rates of community transmission if we are to safely reopen schools again. So there is baseline criteria being developed that will serve as grounding us in data and science and how we are going to determine whether it is, when it's the right time to consider reopening schools. And that is based in our health indicators that is publicly available. Next slide, please. We have published guidance on the safer reopening of schools, and it is found on our website. The title page of this is below, and this is based on best practices and research that's been published, as well as from the state DPH and the State Department of Public Health and this Cal OSHA. And the main elements of this are that they are, some things that are specific to schools are to create small, stable cohorts that do not mix, because this allows us to contain the virus if it shows up in a cohort to just one cohort and minimize the spread. Also, research has shown that younger children are less likely to contract the virus or transmit the virus compared to older ages. And so a lot of this that we're focusing on is for all grades, but particularly for younger children. We also want to limit the amount of movement within the school. And this includes entering a school, leaving the school, and moving within the school, such as up and down the hallways. We want to have symptom screening on site so that if anyone is exhibiting any symptoms, that they decide to stay home if they are feeling any amount of illness, and if they're feeling sick. And then what are the triggers for a school site to decide when to switch to distance learning? And also specific trainings and communication plans for schools. Some strategies that are universal for all sectors, including schools, is that we want to make sure that there is cleaning and disinfection, that there is face coverings, that there is some healthy hygiene habits, including hand washing, physical distancing, and also robust testing and contact tracing. Next slide, please. At this moment, schools are not open, so we have created guidance and a directive for out of school time resources. This is wide ranging. This allows for learning hubs, both public and private, as well as recreation and care activities. And it also includes guidance on youth sports based on what has been published by the state. And basically youth sports is very limited to small, stable cohorts of physical activity that is only conducted outside and must be 6 feet apart and with their own equipment. We want to emphasize that out of school time programs may use school buildings or school property, but schools themselves cannot run out of school time programs. This is because the state has put San Francisco on the watch list, and as part of their guidance, they do not allow schools to operate in any counties that are on the watch list. Next slide, please. So we have, in the month of August, we have published a lot of guidance and information related to schools, childcare, and programs for youth. We have, as I mentioned earlier, we did published a directive and health guidance for out of school time providers, and included updates to the health order to reflect out of school time programs. We also published a preliminary guidance on reopening schools, as I have mentioned earlier, and also some guidance on what are appropriate health checks for children on site, including screening children for the full list of symptoms as recommended by the CDC. And as well, if they are considered a close contact, they should not be coming to any facility. And also FAQ for sites on what it means to do contact tracing at any school site, childcare or programs that serve youth, as well as a quick guide on and some communication templates for when there's a considered someone has symptoms versus whether there's an exposure, whether there's an actual confirmed case, and what are the actions that are needed. We have also published a tip sheet on reducing the risk of COVID-19 for these learning pods or micro schools that people are, some parents are forming. We recognize that everyone is struggling to do distance learning and coming up with ways to do this. Technically, learning pods are not permitted under the stay-at-home health order because we do not allow households to be mixing inside people's homes. But we recognize people are doing this anyway, so we are offering some safety tips on how to proceed with that if one does decide to move forward. And all of this guidance can be found at this website in this white box down at the bottom of the slide. Next slide, please. Testing is, of course, a strategy that we are using to monitor and this virus. And there has been some recent legislation encouraging primary care providers to offer robust testing. And in fact, the Department of Managed Care has filed emergency regulation to require health plans to pay for COVID-19 testing. And San Francisco has issued a health alert to providers to conduct COVID-19 testing. And also, just recently, the state has also filed legislation instructing that all teachers are considered essential workers and should be tested as well, and as frequently as possible. So we are strongly encouraging everyone to contact their primary care provider if they feel like they need to get tested. There are additional testing resources available at this website that is published on this slide. And of course, flu season is coming, so we are encouraging everyone to also get their flu shot, and this will actually help reduce the spread of virus and the coughs and sniffles that we all experience as parents and caregivers. And I think, next slide, please. That is the end of my presentation. I want to thank you for having me here on behalf of the Department of Public Health. All of our information is posted at this website, and I think it's ready for some questions.
Wonderful. Thank you so much, Anna. And thanks again for taking the time to be with us tonight. And I want to thank everybody who helped put all this information together for us. So I want to move to questions. And as I mentioned before, we received some ahead of time, and I'll go ahead and start with those. If you are somebody listening who didn't submit a question ahead of time and some have come up for you during this presentation, please go ahead and put them in the chat box. I will be monitoring those after I get through the initial list. For those who are listening to Spanish or Chinese interpretation, the interpreter will translate this. You can also type your question in your language in the chat box, and we will make sure that the interpreters see it and we'll get your question asked as well. So to go ahead and get started, a couple of questions. One is, one of your first slides, you had a map of districts in the city who are hit harder with transmission rates than citywide. And so one of the indicators we're looking at for schools to be reopening is a citywide list. And so I was wondering, will it have any impact if we see some neighborhoods that have a higher transmission rate? Does that affect what can open in those neighborhoods? Or are you looking as a department at the entire city as a whole versus transmission rates in particular areas of the city?
And this is in respect to school reopening?
Well, it can relate to schools, but yeah, generally with how we're reopening things, is it always a citywide approach as opposed to neighborhoods that may be having higher transmission rates?
For general reopening, my understanding is that it is a city, we were looking at citywide indicators. And when it comes to schools, as we all know, the student assignment system draws families from all over the city. And so it does feel most appropriate to be looking at a citywide indicator in order to consider school reopening.
Okay. All right, so there have been some articles. We had a couple questions about this, about children who are younger, who we've generally seen as not transmitting the disease or transmitting the virus as readily. And there's been some reports recently that seems that they could be super spreaders. And so what are you all looking at that data? How is that affecting your recommendations related to schools or childcare? Are there a lot of peer-reviewed studies that are having you all rethink anything related to young children?
I am part of a group at UCSF that just put on a webinar series. It's called UCF Cares, and they've been talking a lot about school reopenings, and they have been analyzing a lot of this research. And there is, and I must say, I will say I'm not the most well-versed in all of the ins and outs of the publicized research, but the general theme of all the publicized research does seem to support that younger children do not spread this virus as much, and do not have as severe symptoms. The research that is about super spreaders, as far as this team of researchers has informed us, is some of that publication is flawed. And I am sorry to say that I can't tell you exactly how, but that some of it it's problematic.
Okay, thank you. And are they, you said, so are they talking about it in those UCSF presentations? Is that somewhere that people can go to learn a little bit more about how that research has been progressing?
We can bring that back to them. Yes.
Okay, great. We also received a couple of questions about high schools. When you have the recommendations to have small, stable cohorts, high schools are not set up quite that way. And so what have the recommendations been, or what are you all thinking about when it comes to older students who transmit the disease similarly to adults, but don't easily fit into small, stable cohorts the way elementary schools and younger children can?
That is an excellent point, and that is true. High schools do not function in that regard. And I am pulling up our guidance right now to find the exact language that we have published. But in essential, we do say that try to cohort as much as possible, and even consider strategies such as creating block time schedules, so that it would reduce the amount of movement. So I actually have found this language. So what we have published says, for middle and high schools, larger cohorts made up of students from more than one classroom is allowable, but keep these cohorts as small as possible while ensuring that cohorts are not segregated by race, ethnicity, or socioeconomic class. Limit the crossover of students and teachers to the extent possible. Crossover of students between cohorts is permitted to meet the students' educational needs, and also consider block schedules or other schedules with longer classes and fewer subjects per day to decrease the number of students that a teacher interacts with each day. This will also decrease opportunities for students to mix in the hallways. So those are some examples of creative ways to handle high school COVID-19 mitigation and prevention in high school.
Okay, it'll be a big puzzle when we get there, right? I think that
When we get there.
it's easier said than done, right? When we get to high school. So, okay, thank you for directing that. And I know the link, is that all included in the general link that you had on that slide? That there's the spot on?
Yes, and I can put this right here in the chat.
Wonderful, thank you. We have a couple of questions that have come in related to outdoor learning spaces, and I'm wondering if there is guidance specifically from the department around that. And also there's a question here in the chat related, not quite a learning space, but do we have an idea when playgrounds will open and what the guidance is for determining when that will happen? So both using outdoor learning spaces and then separately but related playgrounds.
We do not have separate guidance on outdoor learning spaces, but we do include our guidance that I just posted, or in any of the guidance that we post actually, is to maximize outdoor space as much as possible. It is obviously much safer to be outdoors for ventilation purposes. This virus does not seem to survive very quickly for very long in sunlight. So it is a safer thing to do, but we do not have separate guidance on that. We just encourage it in pretty much everything we're publishing. And
Okay.
I'm sorry, the question about the playgrounds, I am assuming you mean our public playgrounds.
Right, the rec and park playgrounds across the city.
And I am not clear. I do not know the answer to that question. I do recall, this is before we were put on the watch list, that playgrounds were scheduled to open in phase 3 of the mayor's reopening plan. But that was before we were put on the watch list and went on pause. So we'll have to revisit that when that plan gets refreshed.
Okay, and can you remind us, I know you referred to this in the presentation, but remind us what the criteria are to be removed from the watch list?
I actually don't know the actual criteria from the state to be removed from the watch list. I know what our criteria is locally, but I can find out that answer and bring that back to you.
That would be great, thank you. Okay, let's see. Related to your question, or to your talking about testing earlier, do you know what the plans would be for COVID-19 testing and monitoring if the numbers go down and schools are allowed to reopen? So for students getting tested for, as you said, the educators are now classified as essential workers, so we know they can be, they're eligible for essential worker testing, but in general, will there be increased testing available when schools reopen, whenever that happens to be, that it will be in partnership with the city and the district? Do you have any idea?
We are working on those strategies right now, and also the city is ramping up testing capacity to be increased starting in September, which is in a couple of weeks. So, but we are working on that. Yes.
Okay, thank you. We had a question, both submitted ahead of time and one related here in the chat, that was about summer camps, and wondering if you can share with the summer camps that were happening across the city this summer, do we know how many children got COVID in those camps, and how many counselors and how many summer camps were involved? Just are you able to share kind of a bigger picture on what the spread of the virus was like during those?
For summer camp, one of our doctors was in this UCSF Cares webinar series and presented that data. But in summer camp, for total, there was approximately 2,500 to 3,000 children registered in summer camp, both public and private summer camp, and there were only 38 cases total, which is relatively small.
So 38 cases of children?
Altogether.
Altogether. Do you know what percentage of those were leaders, adults versus children?
I do not know.
Okay.
I can bring that back to you.
Okay.
But
Hi all,
in
this is
general,
Andreina, the interpreter. I'm sorry to interrupt. May you please wait a few seconds
Yeah.
after to respond, just because it takes more time to interpret into the Spanish. Thank you very much. Take it away.
Thanks, Andreina. Let's see. So we were, so you just said you could find out and let us know what the proportion was of children versus adults.
yes.
Okay.
And I'm also pausing for the translator. I want to address a comment that I see in the chat about the 500 cases. That was my mistake. I made that mistake. I looked up that data relatively quickly in that hearing, and I read the wrong slide. It is actually 38. So on the record, I am correcting myself to say that it was not 500. It is 38.
All right. Thank you very much for clarifying that. Okay. So let's see. Let me move to some other questions that we have here. I wonder if you could talk, if you know, and can share a little bit about, you know, that you had the out of school time slide, and you said that out of school time programs can use school buildings, so they can work inside a school building. They're not, schools cannot operate those programs because the state is not allowing schools to run when a county is on the watch list. How is it that the decisions are made around what is allowable in an out of school time program versus a school? What makes it allowable in that fashion versus in a school? Do you have some context to that?
I'm sorry, I think I need a little bit more to answer that question.
If we have students that we're allowing to be in smaller groups inside school buildings, and so they are still the age of school children, and they're in school buildings and they're run by nonprofits or city agencies, how is the determination made that that can happen as opposed to allowing a school to be open? What's the criteria that allows one and not the other?
It is purely because of the state guidance that was issued on July 17th
Mm-hmm.
about schools not being able to open on the watch list.
Okay.
It is purely a legal matter related
Okay.
to the state.
Okay. All right. Great. Thank you. Okay. Let me see what else we've got here. Some of these questions that were submitted, you may not be able to answer. They might be questions that are for the school district, but I'm going to try a few of them and see if you know. And if you don't, it's okay. These might be questions we send over to the school district. We had a question about face masks. Will they be provided for each student each day, or will parents have to ensure that their students come with face masks? How does the PPE work for students when we go back to in-person at some point?
That is a very good question for the school district.
Okay, I'm going to make my notes here, and we'll ask the school district these questions. Let's see. Let's see. There are some questions we received about ventilation systems and HVAC systems in schools. Again, I know that our facilities department at SFUSD is working on a lot of these questions. Do you have any insight? Is DPH working with the school district on any of these, or is that purely a facilities department at SFUSD question?
At this point in time, that is a facilities department question.
Okay. All right. Let's see. All right, there's a question here that this is a little different than most of the questions that we received, but it's about school nurses, and a comment. It's probably a little bit of a comment, but I wonder if you have any information you can share about this. But the comment was, or question is, shouldn't school nurses be employed by the Department of Public Health as opposed to the school district? I know this is a question that has come up in the past with our Public Education Enrichment Fund, when, you know, city perhaps in-kind services of nurses to the district many years ago. But I wonder if that's something that's ever talked about that you might have any information about.
I must admit I have absolutely no information on that topic whatsoever.
Okay, all right. Great. All right. The school district has made some, has listed some priority groups for when we move into a phase 2, where there is a blended situation where not all students are coming back all of the time, largely due to the distance requirements, the physical requirements of the facilities. And so they have some priority groups. And so is there some way that you are working, that the Department of Public Health is working with the school district on those priority groups? For instance, we have students with disabilities who really struggle learning in a distant environment, and bringing them back early. Is there specific guidance or ways you're working with the school district to support those subgroups of students who may have higher needs?
We are encouraging for those subgroups, for both the community learning hubs and in school settings, to be prioritized for enrollment, mainly for the out of school time programs. We do hope that, we don't publish that in our school's guidance, but in the hopes that schools would be able to reopen. But that is the top priority of the health department in general, is to support communities that need to close the gap on the health inequities and to provide the services that are needed.
Okay, thank you. Okay, let's see. We also had a question come in about something. Actually, our last forum, somebody asked about this as well. The state talked about elementary school waivers. It is my understanding, please correct me if I'm wrong, that that is something that a school district applies to, or a private school. It's not necessarily individual schools that it can apply for an elementary school waiver for reopening if your county is under a watch list. Is that correct? Can you give information about that to answer anybody's questions who may wonder about that?
Yes, so the way the state has structured the waiver application process is that it is either a superintendent of a district or the equivalent, which for a private school would be the head of school, could apply for a waiver. So it in the example of the San Francisco Unified School District, it would be the superintendent that would ask for a waiver. However, all of the prevention and mitigation plans would have to be site specific per each school to understand that all of the measures were taken place and to make everybody as safe as possible.
Okay, thank you. Thank you for that. And so there's a follow-up question here in the chat about public playgrounds. I'll just read the question out loud. How can we influence the state to reopen playgrounds in phase 2 like other states, for instance, New Jersey and New York? Is there a way to influence that other than calling the governor's office?
You can call the governor's office, and you can call the mayor's office as well. Yes, you can influence it by contacting your local legislators. That is the best that I can offer on public playgrounds. Sorry.
Yeah, no, thank you. Okay, thank you. PTA is an advocacy organization, so it's something, and parents are natural advocates for their children. So even if individual parents want to speak up, then it is absolutely, we encourage parents to speak up for their children. I'll just read this out. This isn't a question for you, Anna, but this is just a comment that I think is helpful reminder from Erica at Burton. There is the Chief Facilities Officer for SFUSD's name is Dawn Camelot. I always mispronounce her name. Camelanathan, right? I always mispronounce her name. She posts facilities updates on Instagram. She has a big Instagram account. If any of you are on Instagram, she loves to talk to parents. She's looking for ways to partner with elementary school principals to chat through what in-person learning could look like. You can follow her there. If you haven't spoken with her, people on this call, she's very receptive. She's very creative. If you have ideas, she's always willing to hear them. She used to work with the Department of Recreation and Parks, and so she also has a lot of understanding and knowledge about our outdoor spaces. So please, thank you. Somebody's helping with my pronunciation that I always mispronounce there. So anyway, so follow Dawn and connect with her if you'd like to. And let me see what other questions I have. We've actually covered most of the questions that I've received. So if you all who are listening want to add some more questions to the chat box, please do, because we've covered most of what I received ahead of time. But let me just make sure. There were, of course, questions about, is there any hope that school will resume before January? And do we know what school will look like next year? Will we go to in-person? And I think I can probably answer that for you. That I wish we could predict what the virus will do, and we don't know, and we don't know how the people will respond and do what we ask them to do related to the virus. And so as much as we all wish we could predict the future, we can't. And so we do our best to follow the guidance given to us and hope that we can get through this as quickly as possible. How's that for an answer?
That was perfect. I'm so glad you answered that question.
Yeah. So, but it's understandable. Families are so stressed out right now trying to navigate this. As we have seen, it's not generally our systems haven't been set up to really support working families who are trying to balance work and doing at-home learning. And so people are really feeling that and trying to figure out ways to get creative and to work with their schools to have ways to support the families through this. And so I think the guidance is helpful, and we just are constantly hearing the stress and sort of the survival mode that parents are in. What other questions do we have? Let's see. Another question I just received. I hear parents talking about gathering in person in larger groups to get their kids together outside of school. That doesn't seem safe. Is it allowed?
Can you say that again?
Sure, I'll read it again. I hear parents talking about gathering in person in larger groups to get their kids together outside of school. That doesn't seem safe. Is it allowed?
That sounds like a play date.
Sounds like a play date to me. Yeah. And I'm not sure
Play
this
dates
question
are
doesn't.
not permitted with household for those outside of your household at this time. Again, limiting the mobility and the mixing so we can reduce community transmission so that we can reopen schools.
Right, especially indoors. And outdoors, there is some guidance provided on the Department of Public Health website, right? If you are outdoors and how you still should be, well, actually, I'll let you explain what the guidance is, because I've seen that there are groups of the number of people trying to restrict it to your home group who you live with, and how that works.
Better yet, I will find it for you and put
Wonderful.
it in the chat so that we can, everyone can have it the most accurate. So I am putting in what is our tip sheet for small outdoor gatherings in the chat. And that we are not allowing people from different households to come together, no more than 6 for, especially if it's an outdoor gathering, when it involves meals. Meals are complicated because you have to take off your face covering in order to eat and drink. And then my personal observation is that people forget to put it back on after you're done eating and drinking. So, and then in general, I'm pretty sure we limit the outdoor gatherings to 20 people if you're not involving meals.
Okay, so small gatherings are allowed as playdates if you follow the gathering tips, or are playdates exempted from this? That's the question I just received.
Well, the outdoor gatherings, we still want people to stay 6 feet apart, wear face coverings, and this outdoor gatherings is not age restrictive. We don't mention ages, but we as parents and caregivers know that it's harder for, especially for younger children, to maintain, especially maintain the 6 feet apart. So I think we are discouraging playdates at this time, as hard as that is, as a result.
Okay, thank you. We've got a couple more questions that have come in. So how do we learn about plans being made for the next phase, especially the young kids that can't sit and learn in front of computers? I think that's an SFUSD question. And so I will answer that the best that I can. If you go to the school board meetings, they are regularly talking about these as they're making plans for phase 2. Some of the ways that they're thinking about that are in the original distance learning, or in the fall learning plan that the school board that the staff presented to the school board on July 28th. I can find a link to that and send it to you all with the links after this meeting is over, but that does talk a little bit about what phase 2 will look like. And we do know that the school district is prioritizing these subgroups, as I was mentioning earlier. It's students with disabilities, moderate to severe disabilities. They're also prioritizing pre-K to 2nd grade because they know that distance learning is very difficult for our very young children. So that is a group they're prioritizing. They're also prioritizing students who are, they're calling them under-engaged with distance learning. If they're having a less than 60% attendance, they will be prioritizing those groups. And then they're also prioritizing homeless and foster youth in that group. Again, it's a very vulnerable group of students. So those are the groups they'll be prioritizing as they begin moving to in-person. And we don't know, of course, when in-person learning will start. That is dependent, as we said before, on what the virus does and how we all follow the guidance. And so I think that's probably the best I can answer that question right now. But if you continue to follow the board meetings, you'll hear that guidance as it comes. And the district's website, they've been pretty good about updating it. So if you go there, you'll find a lot of resources. Next question, we've got just a few minutes left. This, I'll just read it to you. It was sent to me privately. It says, if the science ends up suggesting a larger distance, such as 10 feet instead of 6 feet, how much might that alter the Department of Public Health's current recommendations? Will it change the recommendations for returning to school at all?
At this point in time, my understanding is most of the published research, I'm sorry, I have a tickle in my throat, supports 6 feet as a reasonable distance to prevent the mitigation and mitigate the spread of this virus. If there is substantial research that shows that a larger distance is necessary, we would take that under advisement, but that's not the case for right now. And that's why we are not internationally, nationally, we're promoting 6 feet apart.
Thank you. We have another question that says, has the Department of Public Health provided any guidance, support, or advice for addressing the loss of physical education in public schools or for families outside of the school setting?
The guidance that we have published so far is directly related to COVID-19 and prevention and mitigation. We do recognize that there are adverse health impacts for the loss of physical education or just distance learning, and are even more extremely interested in making sure we get lower rates of community transmission so that we can safely open schools as much as possible. We're doing the best we can. And this is it's a tough situation.
It is very tough. We appreciate how hard everybody's been working at the city level, at the school district, to try to help get us all through this. And so, parents, everybody who is in this meeting, it's really helpful for you to continue asking questions because they are thinking of lots of this, but it's important for us all to continue asking questions to get the information we need, and to work with our public agencies to make sure that they are meeting the needs of their constituents and the people here in our city. So keep asking your questions. We probably have time for one more question if there's anybody who wants to enter one in the chat. quickly, and otherwise we'll just wait a second. All right, I'll ask this one, and then we'll close up because we're getting close to 8:30, and we do try to keep you all to 1 hour and not take more than that, especially on a school night. So we have, okay, actually we'll ask both of these quick questions. I think they'll be fast. Are there any recommendations for air purifiers for classrooms?
We are, to my knowledge, we are not having any recommendations for air purifiers for classrooms. It's more about the ventilation systems and filtration and the HVAC systems, and it's not specific to air purifiers.
Okay, thank you. This is a comment that says, I heard the school board and Newsom approved small groups of special education students can meet in person. When is that happening, and is there a timeline for when this happens? I'm not sure if that's something I haven't heard before. Do you know what that's referring to?
The state has published some guidance related to cohorts, and that in that guide, and that actually just came out yesterday, officially. So, and that does make some reference to supporting specialized services. Since that came out yesterday, I'm assuming that the school board has not acted on that, but that would be a question for the school district.
Okay.
Michelle, can I
Yes.
interject for a moment? Hi, everybody. My name is Carla.
Hi,
I am
Carla.
a member of the Community Advisory Committee on for Special Education. So we advise the district on special education issues. We're actually having a meeting tomorrow night, and I believe another member in here, Suze, it can drop it in the link. And we will have some district people at that meeting. It's our general meeting, also on Zoom, and perhaps they can answer that a little further. I think that would be great. If you are interested in that, we will drop that into the chat. Please, you're welcome to come. We are going to also be on Facebook Live. So if you're not able to get into the Zoom, you can access it there. And so that's a nice way to do that too. But Suze has just dropped it in to the chat right now. So thank you so much for answering to the best of your ability. And I didn't mean to interrupt. I just wanted to throw that out, that if you're interested in more information, you can come tomorrow night. So thanks.
Thanks, Carla. Okay. All right. Well, since we're hitting 8:30, I'm going to go ahead and close us up and just say that Ms. Validzic, it was really great for you to take the time to be with us tonight. I know it's late, it's a weeknight, and we appreciate all of you parents who were able to join us and taking the time to learn this information. We're going to put the recording of this meeting onto our YouTube channel, the 2nd District PTA YouTube channel, by Friday, and I'll send out any links referred to tonight on the PTA President listserv. Are we able to get, am I able to send this presentation? Is that okay, Anna, if we send this presentation around to folks? Okay, great. So we'll also send you a link to this presentation. We also have been recording the audio interpretation of this meeting, and so on our SFPTA website, we will post the recordings of the Spanish and Cantonese interpretation in case you'd like to share those with your families as well. And just want to thank everybody who helped make this event happen tonight. Thanks so much for coming, and we hope to see you next week. Thanks, everybody.